Hello, Mr. President and Mr. Secretary. Thank you for allowing me to talk to you today. I'm K.C.Otenti, a concerned U.S. citizen who has barely left the house in over 3 years due to the ongoing pandemic. I urge you to extend the COVID-19 public health emergency. First, thank you to the countless doctors, researchers, and COVID sufferers who have been sharing their knowledge and experiences throughout the pandemic, without whom I would be woefully uninformed. Today, I'm going to talk about the importance of access to testing, treatment, and vaccines, the confusion around COVID-19 messaging, and how the public health emergency addresses 3 of this administration's priorities. As you're aware, the public health emergency, under Public Health Service Act, Section 319, has allowed for funding, personnel, and research to respond to, prevent, and treat SARS coronavirus 2, better known as COVID, which is the 3rd leading cause of death in the United States. For us average citizens, the public health emergency means tests and vaccines when we need them, lower risk of catching COVID, and hope that the pandemic may one day end. The public health emergency must be extended to protect the most vulnerable people in the United States. Because if the most vulnerable are protected, we're all protected. An important aspect of protection is access to testing, treatment, and vaccines. Under the public health emergency, funding has been available to cover these things. However, for the 18 million people getting kicked off of Medicaid, that access is already being revoked. The rest of us will be at the mercy of our state or private insurers, who are not known for their benevolence. Between that and Pfizer and Moderna's planned 400% price hike on vaccines, most of us are in for some sticker shock. Speaking of price hikes, corporate greed has skyrocketed the cost of goods, while most U.S. residents are unemployed or underemployed. Some of us have not been able to find work because of the pandemic. Others have had to reduce their hours or even quit because they've been disabled by COVID or long COVID. We already often must choose between medication and food. We can't afford the added financial burden of paying $12 every time we test and $130 per vaccine, or $530 for treatment when we catch COVID. The point is, if testing isn't free, people will test less often. Those willing and able to leave the house will return to work or school or brunch, not knowing that they're infecting their coworkers, friends, and neighbors. The virus will spread, not only infecting and potentially disabling more people, but providing more opportunities for the virus to mutate. As a side note, I bring up disability a few times, and it's not because disability itself is bad or scary. It's because being disabled in the US means getting left behind. That's what's scary. The other thing about access is we know vaccination lowers the risk of death. We also know that only about 17% of people in the US are fully vaccinated, which means that with greater transmission comes greater death rates. I recognize a lot of this boils down to funding, but our one advantage over COVID is that we have the ability to significantly reduce transmission. To do so, we must invest. There are many areas, including police and the military, that are wildly overfunded. Mr. President, when you say you want to champion America's values and human rights, then you fund murder at home and abroad rather than provide protection against a deadly virus? Well, the bottom line is, the American people want and deserve protection. And that's not just access to testing, treatment, and vaccines. That's also access to information. In this age of misinformation, people are hiding the truth, especially if it's bad news. Letting people think there's nothing to worry about will allow further obstruction of the truth. The CDC, previously an organization at least I felt I could turn to for information to help keep me safe, has done a terrible job at keeping the public informed with correct and true information about COVID, its transmission, and its effects. The Tyee did a great roundup article of some of the facts that have been downplayed over the course of the pandemic so far, including COVID is airborne. Repeat infection means greater risk. Vaccines alone aren't enough, and that ending the pandemic is not up to personal choice. Studies over the last 3 years have proven that COVID is a vascular disease. This means that SARS coronavirus 2 can attack anywhere in your body that gets blood. COVID causes brain damage at about 10 times the rate of average annual aging, with the worst outcomes for those in their 70s and 80s. COVID can rapidly progress existing dementia, and even in people with no previous cognitive impairment, COVID is linked to losses in executive functions, attention, and memory. COVID causes heart damage, stroke, and an increased risk of developing diabetes. It can be passed to fetuses during pregnancy, and it attacks T cells. Long story short, COVID is worse than the flu. And just because recent variants seem to be less deadly doesn't mean we're safe. Kraken, Omicron variant XBB.1.5, is the current dominant variant in the US, but newcomer Arcturus, XBB.1.16, is already making headlines. Unfortunately, authorities haven't had much to say about the variants. Not extending the public health emergency signals to the public that COVID's no longer a major threat. To quote disaster strategies, lifting the COVID-19 public health emergency validates the public's denial of the continued deadliness of COVID-19 and confirms to older adults, disabled people, and Black, Brown, and Indigenous people that we are expendable. End quote. Combined with mask mandates ending, which suggests masking is simply a personal choice and not a necessary protection against airborne viruses, even more people will not bother taking precautions. We need honest messaging around the severity of COVID and how to protect ourselves. We also need honest messaging from the White House and Health and Human Services about whether the government will help protect us, as one would assume from the priorities on your websites. Mr. President, your COVID response priority talks about containing the COVID-19 crisis, expanding testing, and a nationwide vaccination program to inoculate people, quote, efficiently and equitably, end quote. Mr. Secretary's priorities align with these. Now, I can't deny you've achieved some of these things, at least temporarily. However, restricting access to testing and vaccination, which is a result of increased cost to the consumer, will undo your progress in expanding testing, and it's hardly an equitable way to inoculate people. In the details of this priority, you emphasize vaccinations, which help prevent hospitalizations and deaths. I'm not arguing that's a good thing, but it should be made clear that masking, air filtration, and other preventative measures not only reduce hospitalizations and deaths, but also reduce infections. You also talk about preparing for new variants. Again, useful, but there'd be fewer variants if the CDC had stood by its masking and distancing messages, and the White House or HHS had supported this. The more COVID spreads, the more it mutates, which is how we get new variants. Our current variants are more transmissible, which not only increases new cases of COVID, but also increases reinfections. With reinfections comes increased chances of long COVID, which currently has no proven treatment. It's true, many people have gone back to their pre-pandemic lives. But by ignoring the people who are unable to do that, you're leaving us behind. If you'll allow me another aside, I noticed that while the president's priority mentions other races, it doesn't mention Native Americans anywhere. You have at least alluded to them in your racial equity priority, which declares, quote, a whole of government approach to embed racial justice across federal agencies, policies, and programs, end quote. You say you'll, quote, end disparities in healthcare access, end quote. The public health emergency has helped achieve some racial equity by allowing equal financial access to testing, treatment, and vaccines. There's certainly other factors that prevent true racial equity, but that's a topic for another speech. Not extending the public health emergency will take away what little equity you've achieved. That's because Black, Indigenous, and other people of color are disproportionately affected by COVID. Latinos, Native Americans, and Black people already make less on average than white folks. The majority of those 18 million people losing their health insurance are expected to be Latinos and Black people. And Black, Indigenous, and Latine people tend to have shorter life expectancies, be less insured, and receive fewer or worse healthcare services than white folks. Speaking of healthcare, which you both prioritize, I think I've already made it clear how failing to extend the public health emergency will undo any progress you've made on expanding access and reducing costs. Between the more than 1,000 COVID variants, the fact that we no longer have peaks and valleys of infection but constant waves, and the removal of mandates, funding, and messaging encouraging the prevention of transmission, more people will get sick. The more people get sick, the more hospitals will be stressed again, and the more the virus mutates, causing more variants. Mr. Secretary, I know the HHS website says, quote, "We will transition our COVID-19 policies, as well as the current flexibilities enabled by the COVID-19 emergency declarations, into improving standards of care for patients," end quote. That's great, sincerely. But many of us are not patients. What about the old, disabled, and immunocompromised, and the Black, Indigenous, and other people of color who've had to change our entire lives to avoid becoming patients? The official statements on priorities sound good, but lives depend on the permanent attainment of these goals. Temporary protection from COVID only delays, not eradicates the danger. I understand the desire to return to normal, but there's no such thing as returning to normal. Not anymore. A return to normal means a return to where we were before this pandemic started. Do you really want to do all of this over again? Over 1 million of us are dead. 19 million of us have long COVID. None of us are safe. Normal is no longer the goal. The goal is access to testing, treatment, and vaccines. The goal is clear and true messaging about SARS coronavirus 2. The goal is addressing and maintaining COVID response, racial equity, and healthcare. Extend the COVID-19 public health emergency so we can protect the most vulnerable among us. Thank you.